Hi, good day. I want to share something very exciting with you, particularly those people who are prone to have chronic stuffy noses, chronic maxillary sinuses, particularly the sinuses underneath the eyes and right on the top of the nose. Seems to just keep you up with lots of pressure. But I'm going to show you something pretty amazing. But before I go into that, I want to explain a little bit about craniopathy. Craniopathy has to do with the skull. If you look at different parts of the skull, it has sutures between these particular bones. Now obviously you have the frontal, the parietal, the top, the temporal, the back, the occipital, and you have a few other ones, but it encases the whole entire skull, and in that skull is the brain. And around the brain and spinal cord, which is your central nervous system, you have meninges. And within these meninges, you have cerebrospinal fluid. It goes within the brain and circulates around that entire spinal cord and around the brain. And as it circulates, you can see that within the sutures of the skull, you can't see it, but it's measured and it's tested that you have a little bit of movement, kind of a pump that pumps up and pumps down and pumps up and pumps down. And this correlates with the health of our body. It's very, very intrinsic, very deep, and very hard to understand completely, but there are many different theories. But the bottom line is, when these particular parts within the skull, within these sutures, these particular parts within the cranium, when they're not moving the way they're designed to move, you can have problems that occur within our entire system. So the science of craniopathy, dealing with the cranium by moving the cranium and shifting the cranium and making sure you have proper movement, they have found that it increases the vitality of the entire being within us, our entire system, systemically, internally, when it comes to muscles, when it comes to how things function. So there is a specific move that I used to do many years ago by touching a certain area above the skull and putting pressure, and people would start to experience their sinuses start to open up, as well as their blocked, stuffy nose start to open up where they can breathe. So this particular technique, you will feel an immediate change of a sensation right on the bridge of the nose and in the sinus, where you'll feel pressure start to release immediately, even if you don't have sinus problems, or even if you don't have a blocked, stuffy nose. So what we're going to do, imagine the top of your head kind of like a pumpkin or like a watermelon. So what I want you to do, I want you to grab the top of your head, 4 fingers on each side of the hand, grab it right on top of the crown. And just where your fingers are barely touching, you can take your thumb, put it on the side near your ears. I want you to grab the top of your head, kind of like a pumpkin or like a watermelon. And I want you to push down and pull it apart. Go ahead, push down and pull it apart. And as you do it, you'll feel an immediate change in the top of the nasal area. As it starts to feel, you'll feel the sensation and will start to open up. Okay, so you put pressure and kind of pull it apart like you're pulling the top of the crown apart as you're pushing pressure down into the top of the skull. You should feel an immediate sensation into the nasal area, particularly on the top of the nasal area near the septum, up top, and as you hold it, you'll feel a release. Now, you can hold that point up to a minute if you like, but within the first 20 to 30 seconds, you should feel an amazing change. It just shows you how complex the human body is. So when you find ways of stimulating points, you're stimulating health, and that's why we're here together right now. Share this video, please, and if you haven't subscribed, please do so. But most important, make it a great day. I'm Dr. Mandell.